Common question we hear at Good Therapy SF is, how do I let go of my OCD obsessions? There are three things we focus on to try to answer this question. First, we focus on acceptance, or we try to focus on postponing the obsession, right? Then we try to change the way we obsess. And then lastly, we try to use supportive statements. So I'll start back from the beginning and go through those 4 points. So first, we have to focus on whether to accept or not accept. And here's a really important lesson, because often we focus on the struggle and the difficulty of having an OCD thought in the first place. And really, the more you try to come at your OCD thought from a place of non-acceptance, where you're saying, I wish this wasn't happening to me, or this is so frustrating, you're actually going to make the OCD thought more intense. So we really recommend you taking a more accepting mentality towards this. So asking yourself, do I want to resist the thought? Or how can I accept this thought? Initially is a good way to approach this process. And that's important, again, because if we accept the thought, we actually increase our distress in the moment, and that gives ourselves the best opportunity to reduce our OCD thoughts in the future. So acceptance is always the recommendation here initially. And try to remember, acceptance does not mean approval. It's just the first necessary step to letting go of our OCD thoughts. So after we accept, we then move to working with postponing our OCD thoughts. So we want to try to interact with our OCD thoughts in a new, non-ritual type way, and trying to postpone them is one way to try to do this. So often we can ask ourselves, okay, I have this thought. Do I want to try to obsess on it in this moment, or can I delay on it for even 5 seconds or 30 seconds, right? Try to work with that mentality, and perhaps you can build that delayed window out over time. Again, these are ways to try to gain control of your OCD thoughts instead of feeling they are controlling you. So postponing that obsession is one way. The second skill here to try is to try to change the way in which you obsess, right? So by change, we mean, can you take a step back and just start to observe or notice that you're starting to obsess? Instead of feeling the obsessional urge is just controlling you 100%, you want to take a mindful moment and step out and try to observe the interaction or observe what is occurring in your mind right now with the obsessive thought. And again, these are all ways of trying to interact with these OCD thoughts in a new way by changing the way you obsess, by mentally noting and taking a step back is one way to do that. And then the final and third skill here to try to interact with your OCD thoughts in a new way is to use supportive statements. Because very often when people have an OCD thought, they're very critical and judgmental with themselves right after they have the thought. So there's a lot of frustration, a lot of name calling, a lot of judgmental feelings. What we want to try to do is interact with that self-criticism or that self-judgment in a more accepting and helpful way. So some supportive statements to try to internalize and try to remind yourself are, this OCD thought isn't helpful right now, or maybe now is not the time to think about it. I can think about it later. One of my favorites is, this is an irrational thought. There's no reason to try to be rational with an irrational thought. Just trying some of these supportive statements instead of being really upset with yourself that you're having these thoughts is going to help lower the internal temperature, lower the sense of distress, and really give you the best opportunity here to try to let go of these OCD thoughts in the most helpful way. If you think you're interested in reaching out to us here at Good Therapy SF or for anxiety or other OCD issues, please feel free to. Thank you.